Good afternoon. I'd like to call the Health and Human Service and Aging Committee to order Wednesday, April 30th, and a few minutes after 1. Madam Clerk, can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Castleberry.
Here.
Mr. Schlepper.
Here.
Mr. Hauser.
Here.
You have a quorum.
Right. Madam Clerk, has anyone signed in for public comment today?
No, Madam Chair, no one has signed in.
All right. We have approval of the minutes from the April 16th meeting. Can I have a motion and a second?
I'll motion.
Second.
Okay, moved by Schlepper, seconded by Castleberry. All in favor, please say aye.
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 And we have a couple of contracts before us today, and we also have a presentation from Pregnant and Possibilities Resource Center. So, Madam Clerk, if you could read the first item into the record, please.
Resolution 2025-0163, making awards on requisition 15297 to various providers in the total amount not to exceed $9,825,469.20 for community-based services to support at-risk children and families in Cuyahoga County for the period April 1st, 2025 through March 31st, 2027 for providers 1 through 10 listed on the agenda.
Good afternoon again. My name is Marcos Cortez. I'm with Health and Human Services on behalf of Children and Family Services. Again, this is a master agreement with various agencies to provide community-based services for our at-risk children and families. Providers will deliver high-quality, innovative, and promising practice services to at-risk children, teens, and families in order that caregivers, birth parents, foster parents, and other kinship caregivers can provide a safe, stable, and nurturing environment for children and youth. Services must be easily accessible, timely, and effective. The overarching goal of these services is to help parents enhance skills and resolve problems to prevent entry into the child welfare system and to lessen the time in the system for those already involved. Knowing that all families can benefit from support in some way, the range of family support can be incorporated into community work across a service continuum. We did issue an RFP for these services that closed on December 16th. This was our second effort at issuing a request for proposals. In the second effort, we received 17 proposals, which took us a bit longer to review than we had anticipated. As a result of this RFP and the review, we did add an additional vendor to the previously funded programs. We do have Deputy Chief Beverly Torres and Latoya Howard here from DCFS, who can better answer any questions regarding the program. And we also have Heather Brissett representing the community of neighborhood leaders, who are kind of the leadership group for these services.
All right. Would anyone like to come up and share anything about the program? I know you took time out your busy schedule to come down. I appreciate you. Usually I have all of them here. I'm shocked we only have one, so welcome. Just share with us how it's going, how this benefits Murtis Taylor, I believe you represent.
That is correct. Thank you, and good afternoon. As stated, I am Heather Brissett, and I am the Vice President of Community Wellness, Chief Program Officer at Murtis Taylor Human Services Systems. For the past 18, 19 years, I've had the opportunity to oversee this program as well as implement it, and I can say unequivocally that this program has benefited families in our communities, most importantly, our children, keeping them safe from neglect and abuse and harm. So receiving this funding will continue to help agencies such as Murtis Taylor to continue to provide needed services in the community to our families, keeping families together and safe.
All right, any questions for Ms. Brissett? All right, this is, sometimes, gentlemen, you'll hear us in the office talk about the collab. So this is the collab contract where they're in various communities. Me and Levine went out recently to Beachbrook, which was added. Had a great conversation. Murtis Taylor, as this contract has evolved over years, has stepped up to the plate and services various areas for this contract. So Marcos did explain the changes that were done. And me and Levine did a deep dive in terms of looking into the contract amounts. There were some questions as we visited some of the agencies, but first primary goal is to make sure that we utilize the funding that we have. And if it's not all used, then we can't have discussions on increasing. So with that, any other further questions? Councilman Hauser.
To the chair, to the speaker, just very quickly, I'm interested in how do you guys work with schools, and then how are we making families aware of these great services you guys provide?
That's an excellent question. Thank you for asking. We work with schools. Schools are aware, they're part of our collaborative. So on a monthly basis, we have representatives from school that come and meet with us to learn about our resources. We have an open door where they can make referral to us should they identify a family that is in need of any services. It could be basic needs as far as clothing, extracurricular activity, tutoring, housing. We go into the schools likewise and we make presentations. We issue flyers. We post information to our websites. So they're very much aware of the services that we offer.
Great. Are these all schools, or CMSD schools, or every school in the county, or?
It's all schools, but most of our referrals do come from CMSD.
And then just my last question is, like, transportation or childcare. Have you seen that as an issue, or I guess what's your biggest issues you've seen with families most recently?
Most issues are tied to housing.
Yeah.
Most issues are tied, families are very transient and they're having to move. They need assistance with security deposit, first month rent. Oftentimes that's due to jobs, lack of jobs, being fired. I mean, it's a whole gamut, and it's a circle in that sometimes it's child care related, because they're not able to take time off from work, or they miss so many days at work. They sometimes get, fired or let go. And as a result of that, it interferes with the income that comes in. Or we have some families where they don't get paid when they take time off. And as a result of that, it affects the income of the household, which then creates a trickle-down effect and affects all other aspects of running a home.
Last question. You guys have, like, any metrics, or have you seen an uptick in children enrolled in the program, or a decrease, or how do you guys measure success?
So we measure success in various ways. One would be if it's a family whose child was removed from the home, we work with the family to try and get them to be reunified with their children. So if they're reunified and the child is not removed, is then placed back in the home, then we measure that as a success. If families are able to stay together and not be disruptive, that's also looked at as a success. If we're able to keep families sustaining jobs, sustaining housing, that's also looked at as success. So yes, we have various metrics in which to measure the work that we're doing.
I appreciate you, Vice President. Please keep us updated on how we can support.
Certainly will do. Thank you.
Right, just want to make a statement that DCFS, they actually refer the children to these collabs, so they don't get to pick. Zip codes was a very important, so say a family shows up at Murtis Taylor, but they're not in their zip code realm to take care of. I know the CEO did ask for a zip code list so they can refer to the proper collab to help them. So we're really working really close together and making sure that people are not coming out of their way and going to the wrong zip codes. But I believe, Marcos, that all zip codes are pretty much covered across the county with the collabs, or am I incorrect?
Yeah, these various collabs cover all parts of the county, all zip codes.
And then I would say to VP Brissette, the child care voucher. So if if that's ever a problem with, 'cause I've heard from other agencies, sometimes that can mess up the dynamics of families losing their job. So please reach out to Mayor Levine if that should happen.
I definitely will. We currently have a case that I will reach out to you regarding. Thank you. Appreciate it.
Councilman Schlepper?
Hi, through the chair. I just had a question about the Beach Brook contract in particular. I know that they recently sold their property in Pepper Pike, and I was reading about the proceeds to the tune of about $9.2 million for their property, obviously going toward their efforts and moving into Garfield. Has there been any break in services in the midst of that? That just happened in November. I know they had about 4 or 5 months to move to their new Garfield location. Just kind of curious about that in particular, and I know that you were able to visit as well, Chair. So just wanted to get some background about that.
So Beachbrook is actually a new provider for these services, so they're just being added new. So they weren't providing anything up until this point. So they will be as effective April 1st.
And it looks like, Mr. Cortez, I thought the amount for Beach Brook was less than,
It should be at like 135,000, I think.
yeah, but it's saying 220 in the legislation.
I'd have to, is that correct? I don't.
Yeah, so we'll have to check that.
Yeah, I'll have to verify the amount. But it could be, it might actually be the 2-year amount that's on there.
Yeah. Looking at the contract dates, probably
probably
that's
what it is.
what's different on it. Okay, any other further questions, Councilman?
Yes, thank you, through the chair. Marcus, do we have, of these 10 collaboratives, do we have a list of what zip codes they serve? And that
We
is
do.
readily available, can be sent to us?
We can send that, make sure
Okay.
that, we'll send it to Levine, and he'll get it to you.
Appreciate that, thank you.
Yep, we just worked on that. You have a question, Sweeney?
I was just thanking my colleague for the good question.
All right. Would you like this second reading suspension?
That would be helpful, yes.
All right, I'll make a motion to move R2025-0163 to the full council under second reading suspension. Is there a second?
Second.
Moved by Conwell, seconded by Sweeney. All in favor, please say aye. Aye. All right, Madam Clerk, if you could read the next item into the record, please.
Resolution 2025-0165, authorizing a contract with Mental Health Services for Homeless Persons Incorporated, doing business as Frontline Service, in the amount not to exceed $2,075,978 to operate the assessment and administrative functions of coordinated intake for the Cleveland Cuyahoga Continuum of Care for the period February 1st, 2025 through January 31st, 2027.
Marcos Cortez again, with the Office of Homeless Services. The coordinated entry system is the front door to accessing shelter and housing services for persons experiencing a housing crisis in Cuyahoga County. The HEART Act requires that the continuum of care establish a coordinated entry system to ensure that those who are most vulnerable and literally homeless are prioritized for the limited resources available for homeless intervention services. Frontline Services operates a coordinated intake and assessment locally. This includes identifying viable alternatives to entering the shelter, assessing needs to other emergency services, and linking people with the most appropriate housing shelter resources. Frontline is also responsible for comprehensive client assessment, prioritization, and tracking and slotting of available COC housing resources. We do have representatives here from Frontline, and we have Aaron Reardon, who's one of our senior administrators with the Office of Homeless Services, who oversees our contracts and programs.
Okay, if Ms. Reardon can come up and share something about this contract.
Good afternoon, Erin Reardon with Office of Homeless Services. So this contract is with, as Marcos had mentioned, is with Frontline for coordinated entry. This is the culmination of about a 2-year process where we evaluated our coordinated entry, kind of how things were working within the COC, because our office is the COC lead. So that is one of our functions, is assessing how coordinated entry is serving the continuum, how it's best able to prioritize the needs within the continuum, And we conducted an assessment, and as a result of that, we determined that we needed to kind of redesign how we had coordinated entry operate within our community. We then came up with, we got feedback from stakeholders, from providers, from the OHS Advisory Board, and we moved forward with issuing an RFQ for the newly redesigned coordinated entry system. And Frontline was identified as the provider to receive funding for both coordinated entry assessment and administrative services. There are two other providers that receive funding from that, which is United Way, and they operate the access point, so the phone screening center. And we funded a housing navigator through CMHA.
Marcos, were there any other people that bid on this contract?
That it predates Marcos's time. This is when Melissa was still around. The only other provider that responded was LMM, and they responded to one of the other components was unit acquisition, because we did receive some funding from HUD. We got a new grant from HUD for unit acquisition, and they responded for that funding. We haven't received it yet from HUD, so we haven't moved forward with issuing any contracts.
Okay. All right, any questions? I'll open it up to
I'll just say something.
Councilman Sweeney.
Thank you, Madam Chairwoman. I just want to say thank you. You're putting a lot of moving parts together to make it work, and it's, from everything I see, it's working better than it's ever has since I've been down here, and it's because of you and your teammates and all our partners, Frontline, front and center, because that's what we're talking about right now. So I thought I'd take the time to say thank you and keep up the good work, and you should be the one getting the accolades instead of us saying, oh, look, we voted on it, but you're doing the hard work. So thank you.
Thank you, I appreciate it. And it wouldn't be possible without the partners that stepped up. I mean, this redesign was a big thing, and there's a lot of, painful process to kind of get things completely revamped, redesigned, and it's the partners that have been great in working with us in this process.
And Aaron, how long has the new process been in play?
So the contract started February 1st.
So a new coordinated intake, okay.
Yes, and some of the, some of the things were kind of rolling out, like we came up with a new by name list and slotting procedure, and that went live in April. But the rest of the components of the contract were effective February 1st.
Thank you. Any other questions? All right, Marcos?
Yeah, I do want to say, I've been with Homeless Services for 4 months now, and it is an extremely complex organization, and the amount of work that they do with the amount of staff is very impressive.
Say that again. I've been trying to get them staff.
So I applaud Aaron and all the other team members, Allison, Nick, Amanda, and Prentice, for all the work that they do. I mean, they keep moving this thing forward, and it's a big lift every day for them. So I appreciate all their work.
Do you need the second reading suspension?
Yes, it was effective February 1st.
All right, can I have a motion to move R2025-0165 to the full council under second reading suspension?
So moved.
Moved by Castleberry and seconded by Schlepper. All in favor, please say aye. Aye. All right.
Thank you.
Thank you. Thank you, Aaron. All right, Madam Clerk, if you could bring up our guest today that's presenting.
The presentation from Ms. Veranda Rogers, President and CEO of Pregnant with Possibilities Resource Center.
All right, welcome.
So good afternoon.
Good afternoon.
I am Veranda Rogers. I serve as the president and CEO of Pregnant with Possibilities Resource Center, and it is my privilege to be here before you guys this afternoon. I'm just waiting on a presentation so I can see it. All right, so a little bit about Pregnant with Possibilities. I'm grateful for Councilwoman being able to come out. a couple of weeks ago to our center. We are located in Maple Heights, Ohio. A little bit about our work is we're dedicated to 4 pillars. The first one is sexual risk avoidance. We work with schools, ensuring that youth have the foundation to make healthy life choices and decisions when it comes to their health. And we do that through a community-based approach, as well as utilizing, we have what's called Real Care Babies. We also are dedicated to addressing the infant and maternal, as we say, vitality that we see here in Cuyahoga County through the perinatal period. So a little bit about myself. I always like to introduce myself by saying I was born on purpose, for a purpose, and the purpose that I serve. So what does that mean? I was born after 2 ectopic pregnancies. The doctors told my parents that they would actually never have children. So I always say I'm an indication of the promise that babies can be born. They can actually celebrate their first birthdays. They can see major milestones, and we can ensure that they thrive. For a purpose, I was a teen mom. I delivered my son 2 weeks after my 17th birthday. And so navigating the challenges and the stigma that goes into that, as well as being a first-generation college graduate, going back, I do also have an MBA. And in the middle of my master's program, I was taking some emotional intelligence courses, and they said, if you never got paid $1, what would you do and why? And so I knew I wanted to go back into community. While I never saw anyone in my family who was in philanthropy or in nonprofit work, I went on this journey to do so. And so as I started doing the work, I realized that we were failing Black and brown families right here in Cuyahoga County, as well as the state of Ohio, when we look at our infant and maternal mortality rates. And so I am a champion. I am a part of the solution and not a part of the problem. So a little bit about our work, which I started talking about through our 4 pillars, which you can actually see on the screen, which is our Endless Possibilities program. So that's the Youth Comprehensive Sexual Health Education program. We actually partner with Cleveland Clinic. And so Cleveland Clinic providers come alongside our trauma-informed facilitators and administer this curriculum in community-based settings. Our MOM program, which is a 13-series group-based initiative for anyone who is pregnant or up to 11 months postpartum. Our goal is to support them. At our facility, we have a full pantry, so they're able to access everything from diapers, pack-and-play safe sleep units, car seat strollers, anything that they need to ensure that that family is supported with resources. And we use a community health worker model. So all of our care coordinators are certified community health workers. We do have a few who are also certified as social workers and doulas. The clients go through a group-based initiative where they have peer support from their other participants who are also in the program with them. So they get the peer support and the one-on-one support through education, which allows them to have education on everything from financial literacy, lactation, safe sleep, goal setting. And we have a partnership even with Key Bank that once they go through the financial literacy course, they can actually get a one-on-one financial planning assessment with a financial advisor. They all create a family plan as well as a birth plan through this particular program, and our goal is to ensure that they're thriving and successful as a family unit. We support them with transportation to and from our office, as well as doctor's appointments, as well as grocery store runs, making sure that they have what they need to be supported, and their community coordinator addresses any needs or barriers that they may have as they're going through that particular program. Our secondary program, our third program, but is a secondary program to that MOM program, is our postpartum group, which is called the After Party, where families are able to be with us for an additional year. They meet bi-monthly, and now we fuel their goals and initiatives through our work. And so we do a giving component to this particular program, and every quarter we actually distribute funds. So 3 individuals are able to stand up, talk about what they would do with the funds that have been saved collectively and matched by our organization. And we have supported everything from paying off bills, going back to school, down payment on moving expenses or housing. And so that is that particular program. And finally, what we noticed through our data, and data always drives our work and our numbers, is that in 2022 and 2023, that 50% of all of our referrals were for mental health services. And so we knew that we needed to address perinatal mental health, and we are now, our fourth pillar, which will be perinatal mental health. We serve pregnant and postpartum support persons and their children through behavioral health services. This is one-on-one counseling, group-based counseling, as well as we have a component, thanks to the Center for Community Health Solutions, a component for community practitioners who are actually also serving the families to have mental health services. So HOPE was created as a pilot thanks to like Sex Fifth Avenue Foundation, and HOPE stands for Healthy Outlooks on a Postpartum Experience, which we took individuals who had scored moderately to severe on the Edinburgh Depression Screening Scale, put them in a group, and we realized that we were onto something. So we are now Joint Commission certified, as well as certified through OMAS, Ohio Mental Health and Addiction Recovery Services, and we are in the final phase of credentialing to be able to set 9 managed care plans through that particular pipeline. So this just literally talks about everything that I just said. What we also do bi-monthly is we distribute diapers to the community. Our next distribution is actually coming up on Thursday, May 15th. The registration opens tomorrow. It's a first come, first served basis. We open up the slots for 100 families bi-monthly. And in 2024, we serve 526 families. So all they have to do is register so we know what size we need to provide for them, but they're able to get diapers, wipes, and formula bi-monthly through our resource center. This is just an upcoming event that I shared. We will always like to invite you out to all of the things that we're doing. This is actually our 10th year of service, and so in this 10 years, where we have 4 events. This is the second one of the 4. And so we have a sneaker ball coming on Saturday, May 17th. Our third event is we're bringing Vegas to Cleveland at the Park Lane Ballroom on July 25th. And we will have a culminating gala on November 8th at the Embassy Suites in Independence. So we invite you to participate in one of those events. You can find that information on our website at pregnantwithpossibilities.com/anniversary. Finally, our impact. So we have a QR code here. This could also be found on our website. I do have tangible copies that I can provide to each of you, but our impact for 2024, in 2024, we were actually able to serve 267 families through the work that we do here in Cuyahoga County. What you should know is 45% of the people who walked through our door last year already had a negative birth outcome. That means they had already experienced a stillbirth rate, miscarriage, low birth weight, and of that, we still had a 79% full-term delivery rate, meaning our families did not deliver prior to 37 weeks. So it just speaks to the work that we're doing, how we're impacting the community. This full impact report will go in detail in regards to all of our outcomes and our metrics, but we share just a brief synopsis here. How you can support us, we have a pantry, and connecting with us. All of our information is also here to connect with us. As I said, we're in Maple Heights in the Southgate Shopping Center, and I will also provide you guys a tangible copy of our impact report. Thank you.
Any questions? Councilman Hauser.
To the chair, to the CEO, how do you guys, what's your primary funding source? I don't know if I missed it on the slide.
You didn't. So it's actually in our impact report. And so our primary funding source, about 42% comes from foundation. We get about 20% from government, as well as we have a makeup of corporations, individual donations, and fundraising.
And then my next question is, how's you guys' relationship with different hospitals? Is it more like a partnership, or
That is a great question. And so I actually just had an opportunity this week to meet with the CEO of Metro Health. And so we are always looking at ways to bridge that pipeline. I have also had an opportunity, as I spoke about, Cleveland Clinic. The only major health system that we don't have the best partnership with would be university hospitals. But we are always looking at avenues. We are doing some research with UH, but having more of a linkage to their labor and delivery unit as we do with the other two healthcare systems.
And then I'm going to preference my last question by saying I don't think it's too many people who can do, we can have too many partners with this great work. What's the difference between, I guess, your organization and a Birth and Beauties or a diaper bank, or are you guys like a all-encompassing?
Yeah, so we're all encompassing, and so we all work in tandem. And so while Birth and Beautiful Communities focuses on doula work, and so during the period, our goal is we start with foundation as well as walking through with them along their journey and addressing the mental health. So we have the behavioral health lane. We approach our lens from a community-based approach as well as building community, as we say, actually our tacos method, transformation. How are we transforming the lives of the individuals who walk through our door to ensure that they're succeeding and successful? How are we bringing awareness to the cause that we support and champion each and every day? How are we building community, not amongst just our staff, but the individuals who we serve, so that they know that they have support with their peers, our support individuals and staff, providing the outreach to ensure our community has services. So the diaper distribution, and as I say, service, we serve with excellence. We give white glove treatment. We never get a second opportunity to make a first impression.
Well, I appreciate it. I know Jessica Mullock through
Yes.
community work, and she was trying to tell me what you guys did, but I appreciate you coming in today because I wasn't aware as of recently of you guys' organization. So I thank you for coming in and happy to help continue to get the word out.
Thank you.
That's one of the things I said, Councilman. And so I want to thank Councilwoman Turner for steering me in this direction to go out and learn about Pregnant with Possibilities, because I hadn't heard about it. So any other questions? Councilman Schlepper.
I had more of a comment. First of all, I just wanted to say thank you so much for being here. The work that you do, in my opinion, is one of the most, I'm going to say, mission-critical components that we need to tackle in Cuyahoga County. A couple stats that you probably already know, but I think that this is incredible. There are 197 urban counties in the United States. We are ranked 197th for Black and brown women's maternal mortality. We're last place in the United States. And we are 194th for infant mortality. Another thing that I think is interesting is that the zip code that's probably dealt with this the most would be the 44106 and the 44103 zip code, which would probably center on a Huff neighborhood.
They're actually one of our, when I provide you with our impact report, our top 5 zip codes that we've served last year.
You know, and I think what's staggering to me about it is it also happens to share a zip code with one of the best health systems in the world, which means we have a lot of work to do. So I want to thank you directly for this particular work. You are saving lives, changing lives. We need to continue all hands on deck with these types of programs and these types of organizations. So thank you so much for being here. And I'm personally happy to support you.
Thank you.
Councilman Castleberry.
Thank you. The one question I was going to ask, Mr. Hauser asked about your funding. I was curious about the funding sources. So with that being said, I just want to thank you for the work you're doing. It's like Mr. Schlepper said, you're saving lives. Some of the statistics he threw out, I didn't know all of those. Obviously, you know about that. You know you're making a difference, and hopefully you'll continue that work, and we can help you if possible. Thank you.
Thank you.
Breaking down barriers by connecting these various communities, because there's a whole journey to having a baby, not just going to the hospital and delivering. There's so much more that comes with it. And so the more that we connect at one organization with another, is very helpful for the families and the children that we want to be born safely. I do know Birthing Beautiful Communities, also in part to them helping delivering the babies, they do have partnerships with each of the hospitals where they're working on one with UH. So just let me know if you have any issues with UH. Or
Sure.
you know. But yes, in order to get that baby successfully here and on the right track, there's a lot that comes into play sometimes. And as we heard from VP Prezette today, housing and all those other outside issues sometimes impacts the families that goes and sees Miss Veranda. Any other, Sweeney, you have any questions or comments? Not today? All right.
Well, not this,
Thank you.
All right. So thank you, Ms. Rogers, for coming out. Our listeners, hopefully your phones will ring for people that did not know about you. And if you would just stay after, I just wanted to ask you a question. Anyone, any miscellaneous business for us? All right, I think I shared everything that we're updating on. We could talk offline. Homeless services. Meeting's adjourned.